I now invite Dr. B.K Rana, CEO, Quality and Accreditation Institute, and he's a board member of maybe every board. Dr. Rana, over to you for your response on Patients for Patient Safety Initiative. You are the one who actually initiated this thought process, and it's most appropriate that you give your thoughts on where we are heading. Over to you, sir.
Thank you, Dr. Lallu. Thank you very much. Thank you, Dr. Agrawal, for having me here. Good evening, everyone. I think it's really overwhelming to see so many people around the screen and off the screen and celebrating the World Patient Safety Day. Thanks, Dr. Neelam, for registering through from Geneva. And I think Patient for Patient Safety Initiative came to my mind a couple of years back when we gone through the WHO programs and Canadian and some others, and then started looking for how we can steering through, because one person or organization is not enough to do something which you need to look at the masses. And that's why the idea came to collaborate with CAHO. And we are very lucky to have found Mr. Somittal and Madam Nadira to steer through this process. And for last 2 years, in fact, 2 years back in 2020, yes, we first time actually announced formally the launch of Patient for Patient Safety. And since then, these two people are really working very hard, and there are a lot of issues. So the whole idea here is, unless we involve patients and families, we will not be able to achieve patient safety in its total sense. We are talking about medication safety. There are situations when patient himself or herself is not in a position to take his or her own medication. So who would provide? The family members. So the family members are equally important to be considered. And that's why I think the concept of treating a specific disease in a person is moving through the person-centric or people-centric care, which means you keep the patient in the center, family members, communities around, and take the whole ecosystem together. And this year's World Patient Safety event on medication safety, medication without harm, I'm really honored and privileged that I have been part of this in initial stage with Dr. Neelam as well. It is really a cause which require a commitment at individual as well as organization level around the world. So Patient for Patient Safety initiative is actually to strengthen that chain for patient safety, where we find it the missing link or maybe the weakest link. Maybe the hospitals and the clinicians and nursing staff doing their best, but what happened afterwards? How we can really involve patient into their own care to make sure that they are safe within and outside the hospital. So therefore, I think Patient for Patient Safety initiative is a game changer in time to come. It has been initiated very well with on a strong foundation of learning and sharing knowledge, which is an evidence from here, over 1,000 people attending this event, because everyone want to contribute towards the patient safety idea and ideology. And I think this is an event which we all celebrate, not only with our own knowledge, but with the collaboration abilities. And I think this is my philosophy personally, that people should come together, collaborate. They should find some common grounds to collaborate and work together. And that would actually make the longest change in the world for any activity, whether it is hand hygiene, whether it is medication safety, or is a safe surgery. So I think this is most significant attitude which CAHO has built. I'm really delighted to be part of this, that they could organize this mega event, brought together the people who really share the common knowledge and wisdom, and they really want to move forward. So I think I won't take much time, because there are a lot of things to be discussed on this topic. It is a topic of endless discussion and deliberation. But I would like to thank CAHO, Dr. Agrawal, Lallu, and WHO, led by Neelam at the headquarters in Geneva, and all the stalwarts for Patient Safety, particularly Nadira Madam and Somittal Sahab, for steering through this. And I personally hope and I believe strongly that we would come out with something which would change the life of patients in their own care. Thank you very much.
Thank you so much, sir. As you rightly said, collaboration is the key, and CAHO believes in collaboration. We strongly believe in collaborating with our patients through Patients for Patient Safety initiative.